Welcome back to our channel. Today, we are diving into an important topic, hernias. We'll be exploring what causes hernias and the various treatment options available. If you're new here, consider subscribing to stay updated on all things health and wellness. Let's get started. 1. What is a hernia? To begin, let's understand what a hernia is. A hernia occurs when an organ or fatty tissue squeezes through a weak spot in a surrounding muscle or connective tissue. This can lead to discomfort, pain, and other complications. Common types of hernias include inguinal, femoral, umbilical, and hiatal hernias. 2. Causes of hernias. Now, let's discuss the causes of hernias. Hernias can be caused by a combination of factors, including a weak abdominal wall due to genetics, aging, or a previous surgery. Additionally, heavy lifting, persistent coughing, obesity, and straining during bowel movements can increase the risk of developing a hernia. 3. Symptoms and complications. Recognizing the symptoms of a hernia is crucial. Symptoms may include a visible bulge, discomfort or pain, especially when lifting or coughing, and a feeling of pressure in the affected area. If left untreated, hernias can lead to complications like incarceration or strangulation, which require immediate medical attention. 4. Diagnosis. If you suspect you have a hernia, it's important to consult a medical professional. Diagnosis usually involves a physical examination and may require imaging tests like ultrasound or MRI to determine the size and location of the hernia. 5. Treatment options. Now, let's talk about the treatment options for hernias. The approach depends on factors such as the type and size of the hernia, as well as the patient's overall health. Non-surgical options include lifestyle changes, avoiding heavy lifting, and managing symptoms. However, in most cases, surgery is recommended to repair the hernia and prevent complications. 6. Surgical hernia repair. Surgical hernia repair is a common procedure. It involves pushing the protruding organ or tissue back into place and reinforcing the weakened area with sutures, mesh, or a combination of both. There are different surgical techniques, including open surgery and laparoscopic surgery, each with its own benefits. 7. Recovery and prevention. After hernia repair surgery, proper recovery is essential. This may involve rest, limited physical activity, and following your doctor's post-operative instructions. To prevent hernias, maintaining a healthy weight, practicing proper lifting techniques, and managing conditions that cause chronic coughing are key. And there you have it, a comprehensive overview of hernias, their causes, and treatment options. Remember, if you suspect you have a hernia, it's always best to consult a medical professional for accurate diagnosis and personalized guidance. Thanks for tuning in, and we'll see you in the next video. Don't forget to like and subscribe for more informative content. Stay healthy.